Hello and welcome. This is News Now on TV360. I am Deji Badimasi. The medical charity Mission Sans Frontières Friday says the recent outbreak of Ebola in West Africa will take at least 6 months to bring under control. Speaking in Geneva, MSF President Joanne Louis called for strengthened international coordination led by the World Health Organization. The recent outbreak has been described as one of the worst ever to hit the region since the Ebola virus was discovered in 1976. The outbreak began in Guinea in December 2013, but was not detected until March 2014, after which it spread to Liberia, Sierra Leone, and lately Nigeria. So far, 1,069 persons have died. The Nigerian casualty has so far been 4, including the Liberian-American Patrick Sawyer, who brought the disease to Africa's most populous country. Louis said that controlling the outbreak in Liberia, which has recorded more than 300 deaths, was vital to containing the epidemic. The WHO recently said that the risk of transmission of Ebola during air travel remained low, as the disease is not airborne. Various aid organizations and international bodies, including the Economic Community of West African States, ECOWAS, U.S. Center for Disease Control and Prevention, CDC, and the European Commission have donated funds and mobilized personnel to help counter the outbreak. Now, the World Health Organization says the scale of the Ebola outbreak appears to be vastly underestimated as the death toll from the virus continues to climb. WHO said its staff had seen evidence that the numbers of reported cases and deaths do not reflect the scale of the crisis. WHO spokesperson Gregory Hart said that experts going house to house in Kenema, Sierra Leone, in search of infected people were discovering more cases. He added that an 80-bed treatment center that recently opened in Liberia's capital, Monrovia, filled up immediately, and that the next day, dozens more people turned up to be treated. Ebola is transmitted by direct contact with the body fluids of a person who is infected. Initial flu-like symptoms can lead to external hemorrhaging from areas such as eyes and gums, and internal bleeding, which can lead to organ failure. Now, in Lagos, Nigeria, Commissioner for Health of the state, Jide Idris, says the state government is committed to effectively containing the Ebola virus disease and ensuring adequate health care for the victims of the disease currently being treated in isolation wards in a hospital in the state. Idris, who addressed journalists today, was speaking against the backdrop of claims by some groups that some patients placed under quarantine were not adequately catered for as the isolation facility lacked basic amenities. The health commissioner debunked those claims, saying they were not true.
We have followed guidance from the CDC and other partners and established the following: a 40-bed complex with male and female ward for confirmed cases, an 8-bed isolation ward upgraded to hold suspected cases, backed up by 2 emergency tents to hold additional 24 suspected cases. We have a dedicated borehole. We also have a dedicated 60 kVA generator backed up by a 250 kVA generator for the entire complex. There is involvement of Loma for medical waste management. We also have 2 5,000-liter septic tanks, one for each of urine and feces, decontaminated prior to evacuation. This is contrary to the rumor currently in circulation that the facility has no basic amenities. We require experts in different medical fields, including critical care and infectious diseases, and these still need to be trained using WHO protocol, which may require up to 5 days of committed training before such experts can apply their skills safely without the risk to themselves. Our international experts are currently providing this training on site. I will expatiate further on this. We thank those few health workers who, out of their personal conviction, have been managing these cases ab initio. We are still looking for more, especially in those specialty areas.
Now, the Lagos Governor Babatunde Fashola was also compelled to address journalists in the light of the new claims. He said that a major challenge in containing the Ebola virus disease in the state is that of skilled personnel, actually. He further said that the management and treatment of the Ebola cases require health experts which must be properly trained, adding that the state was still in the process of capacity building. Fashola also debunked the claim that patients at the Ebola center were not adequately catered for. Take a listen.
It is not true that we are not taking care of patients. The reality is that this is a difficult time. We are gaining capacity every day. It's not something we expected, it's not something we planned for, and therefore getting people who are sufficiently knowledgeable and skilled, but who are health workers, to go in there has been quite a challenge. It's a matter of very, very monumental courage for those who have signed up, and we commend their courage. But there is a personnel capacity issue of those who can go in and look after patients. First, physicians who have to do clinical work there, and then support staff like nurses and all of that who have to help clean up patients, manage their body fluids in a way that they themselves do not become victims. Now, the personal protective equipment that they wear is very, very hot. You are literally sealed in so that you are protected, and therefore it's uncomfortable. And ideally, no doctor or medical worker should stay in that place for any undue length of time. The ideal thing would have been to have teams going in for short periods, coming to rest, and another team goes in. So, but what we have now is that teams are working flat out, and therefore there will be no opportunity to segregate any one patient and say this is a very important personality, so let us give special care. There will be no such opportunity, even from what the experts have told us.
Well, quite disturbing situation there. Now, there's some confusion over the actual number of persons infected with the Ebola virus in Nigeria and those who are currently being treated. The reason is because the figure given by the federal government does not tally with that given by the Lagos state government. Yesterday morning, the Minister of Health Onyebuchi Chukwu addressed a press conference in Abuja where he gave the number of infected persons as 11, but much later in the day he revised the figure. Take a listen to what he said.
The total number of deaths is now 4, having recorded an additional death about the time the minister was giving the press conference. But that the total number of confirmed cases of Ebola virus disease so far in Nigeria remains 10. The explanation for the discrepancy between the morning figure of 11 and now the figure being restated as 10 is simply that there was double counting. In the process of trying to communicate the 4th death recorded so far in Nigeria from Ebola virus disease, they looked at that and found out that what they thought was the 11th case was only problem in communicating the information. Information between the lab, the isolation ward, and the emergency operations center are coded for confidentiality.
Now, that was last night when the minister addressed a second press conference. But today, when the Lagos State Commissioner of Health addressed a press conference, he gave a completely different figure. Listen.
Cumulatively, there are 11 confirmed, including the imported case and one suspect case. The suspect case is awaiting the results of confirmatory tests to inform the next line of action. Currently, there are 8 cases in isolation at the facilities in mainland hospital Yaba. They are all primary contacts of the index case. 2 of the confirmed cases, the ECOWAS protocol officer and a nurse, passed on during the week, bringing the total number of deaths to 4, 2 of which are health workers.
Well, let's hope they reconcile the figures, but the situation is becoming a bit embarrassing. Now, going by the account of the Minister of Health, Professor Onyebuchi Chukwu, the Ebola patients at the Lagos Isolation Center must by now have been administered an experimental drug that could cure them of the Ebola virus. Now, the minister yesterday announced that the government had taken receipt of the experimental drug nanosilver to help in treating the patients.
In the last press briefing, we told you of a Nigerian scientist who have already offered the country one of the experimental drugs, the nanosilver. And hopefully today, that will reach the treatment center. We'll follow all the protocols as governed by the National Health Research Ethics Code of this country in using the nanosilver as part of the treatment regimen. We are also in touch with WHO to see how we can have the buy-in in the drugs, in the experimental drugs that will be donated to WHO.
Now, the nanosilver drug is now generating some kind of reaction from the American government. Without specifically mentioning nanosilver, the U.S. Food and Drug Administration has expressed concern over products now being sold online that it says fraudulently claim to prevent or treat Ebola. The administration said it was aware of such products being merchandised online, claiming to prevent or treat Ebola, and cautioned on their use. Of course, as you know, the FDA's warning comes on the heels of comments made by Nigeria's Minister of Health, Professor Onyebuchi Chukwu, who said that 8 Ebola patients in Lagos will receive the nanosilver experimental drug. Though the agency did not give any products, any name now, any name in its product warning, many say the FDA may be referring to nanosilver. Nanosilver, by the way, has been used as an antibacterial for centuries and has been controversially used to block odors in consumer products such as socks and bedding. It is also sometimes sold online as a dietary supplement, even though Danish researchers found in a recent study that nanosilver can penetrate and damage cells. The U.S. Environmental Protection Agency considers nanosilver a pesticide. Manufacturers of products that contain it must register them with the agency. Now, because of the controversy over nanosilver, we sought the reaction of the president of the Pharmaceutical Society of Nigeria, Olumide Akintayo, over the use of experimental drugs in treating Ebola patients here in Nigeria. Here's what he told us.
There are a number of options, there are a number of trial drugs that people are looking at in this desperation we find ourselves. And you think of things like ZMAP, with a serum product, and nanosilver that you talked about. Now, in the very ideal, if you understand what clinical studies are all about, you have animal test studies, and that's a stage all of these drugs are. They're actually being tested on animal tissues and preparations about now. And the norm, the protocol is that once you succeed with animals, then you begin to use human beings directly. We haven't gotten to that stage with these trial drugs, like I said, but because of the calamity, because of the emergency, we have a situation that is akin to the devil and the deep blue sea. So people want to take a plunge, especially if there is hope that administering these products can sustain life for some more years, even if it is at some at the risk of some degenerative diseases or consequences in future. Even in healthcare, you weigh there's what you call a benefit-risk ratio in administering routine drugs in subclinical disease states. And I guess that's the stage we're here. So if that's the only option left and the client is comfortable with it, I guess we have no other option than to administer these products.
Now, the Nigerian Medical Association has rejected the sack of resident doctors by the federal government, which was announced on Thursday. At a press briefing today in Abuja, the president of the NMA, Dr. Kaode Obembe, asked the federal government to withdraw its circular on the sack of the resident doctors and also reverse the directive. The NMA president also stated that even if the government reinstates the resident doctors, they will not call off their strike, which is over a month now, adding that the government must meet its 24-point demand. The government announced the suspension of the residency training programs Thursday, citing what it calls challenges in the health sector. A protest by students of the Olabisi Onabanjo University turned violent after police fired tear gas to disperse the protesting students. The action by the police led some members of the protesting mob to destroy public property. The protest had initially been peaceful when it commenced on Thursday, with the students taking to the streets to protest the increment in their tuition fees. The students occupied the Presidential Boulevard, the route leading to the office of Governor Ibukunle Amosun of Ogun State, on Friday morning to make their request known. The aggrieved students are demanding a further reduction in their school fees days after Governor Amosun announced a reduction in the fees and says it would take effect from the next academic session. However, the students of the state-owned school say they are not satisfied with the reduction as it is still too high, adding that they want the new fees to take effect from the current academic session. To some business news now, the federal government has said that from October 1st, the Corporate Affairs Commission will commence the electronic registration of companies desiring to establish businesses in Nigeria. The Minister of Industry, Trade and Investment, Olusegun Aganga, made this known while addressing newsmen during the quarterly meeting of the ministry. The meeting was held to review the progress made in the implementation of the federal government's policies and to mediate on some of the challenges confronting the ministry. The minister said that the registration quote would be online would reduce the cost of doing business considerably, as well as the time it takes for local and foreign investors to set up their businesses in the country. This will be the first time ever that Nigeria will have an online electronic system. To some foreign news now, Ukraine says it has ordered its border guards to inspect the contents of a huge convoy of trucks that Russia says is carrying relief goods for civilians in war-torn eastern Ukraine. The controversial aid convoy sent from Moscow has been parked at Ukraine's frontier since the government refused to grant entry to the dozens of trucks. The purpose of the procession of trucks, which abruptly changed course earlier this week, has been the subject of dispute between Russia and Ukraine. The Ukrainian government has expressed fears that the mission is a camouflaged effort to smuggle supplies to pro-Russian rebels and has vowed to keep the convoy out. U.S. and Ukrainian officials have repeatedly accused Russia of supplying weapons to the rebels and building up troops along the border. Officials say the convoy was made up of 262 trucks, not 280 as suggested in earlier reports. The conflict, which has claimed more than 2,000 lives, has intensified in recent weeks. The violence began when pro-Russian rebels seized government buildings and tried to declare independence. The United States and the European Union have imposed sanctions on Russia over its role in East Ukraine and the earlier annexation of Ukraine's region of Crimea in what has become the worst crisis in relations between Moscow and the West since the Cold War. U.S. police Friday said the black teenager shot by police last week in Ferguson, Missouri, was a suspect in a robbery just moments earlier. Ferguson Police Chief Thomas Jackson said Michael Brown, 18, was one of two men suspected of robbing a nearby convenience store. Minutes later, he was shot by a police officer who has been identified as Officer Darren Wilson after a struggle. Jackson described the robbery at the convenience store as being committed without the use of a weapon. Police released to the press by police released to the press show pictures of a well-built black man intimidating a clerk in the store. Officials say the police may have held back naming Wilson for nearly a week because of fears he could be harmed amid a volatile and sometimes violent week of angry protests that have followed Brown's death. Obama has promised a full investigation by the U.S. Department of Justice into the teenager's death, and the FBI has launched its own inquiry. The killing has drawn comparisons by some civil rights leaders with the 2012 killing of 17-year-old Trayvon Martin by Judge Zimmerman, a Florida Neighborhood Watch organizer who was acquitted of murder charges. Now to some sports. Nigeria has formally withdrawn from the 2014 Youth Olympics, which is slated to commence on Saturday in Niger, China. The withdrawal, according to the Director General of the National Sports Commission, Benga Elegbeleye, is in protest to the discrimination against the Nigerian athletes who are already in China for the Games by organizers. He said the Nigerian athletes were quarantined, isolated and barred from training alongside other athletes over news of Ebola virus in Nigeria since they arrived the competition venue. Nigeria's contingent of 12 athletes and 5 officials left the country August 11 for China. The country was due to compete in athletics, beach volleyball and wrestling. Luis Suarez has begun training with his Barcelona teammates a day after Court of Arbitration for Sport lifted his stadium ban. The Uruguay international, who is currently serving a 4-month suspension from football for biting Italy defender Giorgio Chiellini, was banned from all footballing activities, including training. But upon appeal, CAS ruled that he could participate in friendlies and train normally. The 27-year-old began training on Friday and could make his debut on Monday when Barca takes on Lyon FC in the Joan Gamper Trophy. He, however, will still miss the first 11 La Liga games but could make his competitive debut against Real Madrid. Meanwhile, the Uruguayan Football Federation has expressed its frustration on CAS's decision to not lift the 9-match international ban placed on Suarez. Well, let's just hope this guy stops biting people. So on that note, we end News Now on TV360. We thank you very much for watching. I am Deji Badimasi. We'll see you again tomorrow.